up is thyroid antibodies. People aren't being tested for that. Talk about it.
Yeah, so that's another big problem. In functional medicine, as you know, Sean, we're always looking for the underlying cause of the problem, and we're trying to address it at that level instead of just suppressing symptoms. And with integrative or holistic medicine, sometimes what happens is people are still suppressing symptoms, but they're just using herbs or supplements to do it instead of drugs, which is definitely an improvement in many cases, but it's not the real core principle of a functional approach, which is get to the bottom of the problem. And so the main cause of hypothyroidism in the US is Hashimoto's. But it is pretty much universally agreed that Hashimoto's is the primary cause of hypothyroidism. So more likely than any other cause for people in the US. In the developing world, it's iodine deficiency, but in the industrialized world, it's Hashimoto's. And this is an autoimmune disease. And what happens is the body starts attacking the thyroid gland as if it were a foreign tissue or invader. And so the lab tests that you want to do for this are thyroid antibodies. So that's thyroperoxidase and anti-thyroglobulin antibody for Hashimoto's, and then TSI antibodies for Graves' disease, which is the autoimmune condition that causes hyperthyroidism.
For the audience, is it TPO? Is that the abbreviation?
TPO, thyroperoxidase. So the reason why they're not tested often in the conventional world is it doesn't change their treatment plan. Whether you have Hashimoto's or some other cause of hypothyroidism, they're just going to give you thyroid hormone. Doesn't matter. Because they don't have any way of treating the autoimmune dysfunction with Hashimoto's. With a more serious autoimmune condition that's life-threatening, or like MS or rheumatoid arthritis or Crohn's disease, they'll use steroids. But with Hashimoto's, it's deemed that's too much. It's not, the cost-benefit ratio is too great. And so there's nothing that they do. But in functional medicine, we do address the autoimmune condition. So it's important for us to know that it's present because it will change how we treat the particular thyroid condition.